A new CDC report shows during the pandemic, more women died during pregnancy or within the year after giving birth. The risk is even higher for women of color. On this Black Maternal Health Week, Janae Norman has more on the numbers and what's behind them.
Alarmingly high maternal mortality rates. A new report from the CDC showing a 40% spike in 2021, with more women dying during pregnancy or within a year after giving birth.
The U.S. has one of the worst maternal mortality rates among industrialized, wealthy countries. Why do you think that is?
We know that many women don't have access to the preventive and emergency care that they need during pregnancy and after pregnancy. And part of that is that many women don't have the extended coverage that they need for postpartum care.
And another new report looking at over 1,000 pregnancy-related deaths in 36 states from 2016 to 2019, finding that 84% were preventable. Black women are 3 to 4 times more likely to die from a pregnancy-related cause than white women.
We see that there are longstanding structural issues and barriers that have prevented Black women and women of color more broadly from getting the kind of care that they need.
We're not aiming to just walk out alive as as the goal here. That's the baseline.
Emily Rodriguez is a doula and founder of Ashe Birthing Services in New York.
I wish that when people became pregnant, their provider would say, where would you like to give birth? You're a low-risk person. So if you're high risk, I would say let's birth in the hospital. That's what I would like to see. And all the low-risk people birth outside of the hospital or in the hospital with midwives.
Experts say that anyone planning a birth outside of a hospital or birthing center should have certified midwives attending and have access to a hospital if a medical emergency arises. Rodriguez is Dr. Carla Williams' doula. After having a negative birthing experience in the hospital, Williams, a practicing obstetrician, hired a midwife and doula and had home births with her second and third children, joining the less than 1% of women who birth at home, which carries its own set of risks.
I was told by the doctor that, the clock was ticking and that it was going to be time to have a C-section if I didn't continue to dilate and if I didn't deliver soon. I asked for more time. It's funny to say that, to, ask for permission.
2020 data across the U.S. shows about 1 in 5 to 1 in 3 women undergoing C-sections to give birth, and an epidural rate hovering near 80%.
There's been concern about how high the cesarean section rates have been in this country. And look, we want to apply care where it's appropriate. And I think we have seen circumstances where sometimes women aren't offered the full set of options or aren't given the full information they need to help make the best decision for themselves.
So after your 2 home births, how did that impact how you moved forward as a provider yourself?
The biggest thing I feel is just talking to the patients, really explaining things, giving true informed consent and allowing them to be autonomous and focusing on the postpartum period and what's necessary to keep a mother healthy, in that crucial time after birth.
And recent CDC data showing how crucial postpartum care is, finding half of maternal deaths happened 1 week to 1 year after giving birth, while about 1 in 4 deaths were from hemorrhage or cardiac conditions. Nearly the same amount, 1 in 4, were from mental health conditions, with more than 80 deaths attributed to suicide by new moms. The Surgeon General says postpartum depression is a major factor. Mental health and social stressors like lack of resources, returning to work too soon, are important drivers of these mortality numbers.
Such a huge story. Janae Norman, thank you for that. And I want to bring in ABC News medical contributor, emergency medicine physician, Dr. Darien Sutton, for more on this. Dr. Sutton, we are one of the richest countries in the world. Why are so many women dying from having babies?
When it comes down to it, it's really about access. You quoted, we're one of the richest countries in the world, but the least likely to provide health care coverage to all of our citizens. And Black women, compared to their counterparts, are less likely to have access to health care coverage, which makes it difficult for family planning, contraceptive care, pregnancy care, and postpartum care. Also, unfortunately, bias, discrimination, and structural racism don't just stop at the entrance of a hospital, as Black women and other marginalized patients fall victim to that result. And then we just unfortunately don't incentivize hospitals well enough to do patient-centered care.
How did the pandemic factor into all of this?
I think it really probably adds to the concerning numbers that we are seeing. We know that Black people in general are more likely to get infected with COVID-19, more likely to be hospitalized, and more likely to die of a COVID-19 infection. And we also know that pregnancy and COVID-19 create poor outcomes for pregnant women, increasing the risk of miscarriage, preterm birth, and death during delivery. So I think that those factors are compounded on each other, and unfortunately, the weight of that falls on Black women.
Now, Black Maternal Health Week was established in 2018, but we are still not only seeing these high rates for women in general, but Black women are still 3 to 4 times more likely to die from a pregnancy-related cause than white women. Why is that, and how do you fix it?
You know, the answer to this is multifactorial and nuanced. And as Janae just reported in her piece, more than 80% of these deaths are preventable. So what it comes down to is improving access, making sure that we don't just provide access for care during pregnancy, but also before pregnancy for contraceptive care, and then after pregnancy for treatment of diseases such as postpartum depression, and then providing safe and effective access to abortions. Although this has become a contentious topic, it has been long known within the medical world that safe and effective access to abortions is key to protecting women against harm from their pregnancy. And so all of these factors, as well as addressing the unconscious bias that we have as physicians and providers and hospital staff, and again, making sure that we create a goal of creating a patient-centered outcome so that we can better help patients with their individual needs.
So, Dr. Sutton, what kind of action can mothers, and especially Black mothers, take if they think they're being discriminated against, or they feel they're not being heard, or they're worried about giving birth because they think those things are going to happen?
I think first and foremost, identifying the symptoms. If one were to have extreme headache, elevated blood pressure, bleeding, pain, or profound weakness, those are all reasons why you should contact a provider and get evaluated. I think so often do women, especially Black women, go underappreciated for their symptoms, and unfortunately, due to the issues that exist within healthcare, the structural systems of racism, bias, discrimination, the lack of access, all of these fall on Black women and create poor outcomes from their pregnancy. And then also having an advocate, remembering to bring a friend or a family member or someone that you love with you to help process this information, and making sure that if you don't feel like you have a good opinion from that physician or provider, getting a second one.
All right, Dr. Darien Sutton, always great to have you. I wish on a better topic. Thank you for your help.
Of course.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.